Hi everyone, I'm Chelsea and this is my QI project. My focus is improving how we distinguish symptomatic versus asymptomatic UTIs in elderly female patients. This is something I see often in practice and it's an area where small changes can make a big impact. UTIs are one of the most common reasons older women get evaluated or put on antibiotics. But we know a lot of these cases are actually ASB. Treating ASB causes more harm than good, and yet it happens all the time, especially in primary care and in long-term care. In our rural clinic, symptoms aren't always clear, and different staff assess things differently, which leads to unnecessary antibiotics and mixed workflows. Standardizing how we evaluate these patients could really clean this up and improve safety. Here's my PICOT question. My population is elderly female patients. The intervention is using standardized symptom-based UTI assessment protocol. The comparison is our current inconsistent practices. The outcomes I'm looking for are better diagnostic accuracy and fewer unnecessary antibiotics. And the time frame is 6 months. This helped guide the whole project. Right now, we rely on too much on positive urine tests, even when symptoms aren't there. Nurses don't always know when to collect a urine sample, and providers vary in how they diagnose. Where we want to be is a clinic with consistent symptom-based evaluation, strong documentation, and fewer unnecessary antibiotics. The gap comes down to not having structured assessment tool or a consistent process. This is the 5 whys analysis, and when you break it down, the real root of the problem is not that we don't have an algorithm, or standardized training for evaluating UTIs in older adults. Once that's clear, the solution becomes obvious. We need to build a tool and train staff how to use it. The key stakeholders here are providers, nurses, lab staff, patients, and families, pharmacy partners, and clinic leadership. Each group plays a part in how UTIs are assessed, diagnosed, and treated, so they're all important in making the project successful. This is my SMART goal. My SMART goal is to get correct use of standardized symptom-based protocol up to 90% and reduce unnecessary antibiotics for ASB by 30% by June 2026. It is realistic, measurable, and directly ties into antibiotic stewardship. This is the SIPOC diagram. It gives a quick overview of the whole UTI evaluation process. It breaks down who's involved, what information is used, the steps in the workflow, and who the customers are. Seeing it laid out like this makes it easier to spot where we're inconsistent. And then the next few slides show the suppliers, the inputs, the process, the outputs, and the customers who benefit from the output. And this kind of breaks it down a little more. This is my process map, which walks through what's actually happening during a typical UTI evaluation. Right now, the steps vary depending on who is assessing the patient. Mapping it out really shows where a checklist or algorithm could help create consistency. This is my key driver diagram. It connects the aim with the major drivers and the interventions that support them. This makes it easier to stay focused on what truly influences diagnostic accuracy and antibiotic use. For the PDSA, the plan is to train staff and roll out the symptom checklist. We'll test it in the walk-in clinic for 2 weeks, review the results, and then make any adjustments before expanding clinic-wide. This gives us a chance to fix small issues before the full implementation. And here are some of the project measures. The outcome measures look at reducing unnecessary antibiotics and improving accurate diagnoses. The process measure focuses on how often the checklist is actually used and whether cultures follow the criteria. Balancing measures help make sure we aren't missing true UTIs or slowing down any workflow. And I wanted to make sure this project didn't accidentally create new problems. So to wrap up, this project centers on improving safety and reducing unnecessary treatment by standardizing how we evaluate urinary symptoms in older female patients. With better assessment, clearer criteria, and consistent workflows, we can support antibiotic stewardship and improve patient outcomes. Thank you so much for taking your time to listen to my project. And here's my reference list.